health plays a really large part in our economy. I did my master's and PhD at Columbia University, and I got to work with some really great people. My two advisors, one went on to advise President Bush, the other went on to advise President Obama. And I came from there to here. I had a chance to work with the Minister of Finance here on two budgets that worked on reforming healthcare and reforming post-secondary education. I've had a number of chances to work with policymakers across the country, and I think those have all been real highlights for me. I teach a course in health policy and healthcare markets, and this course takes students through many of the major issues in health economics as it pertains to government policy, the way that hospitals and doctors work and function, the way that pharmaceutical companies work, and many of the major areas that people who are thinking about working either in the healthcare sector or with the healthcare sector would want to know. There's a huge problem with how we're going to pay for all of the healthcare we want to deliver in this country, and this is true actually in countries across the developed world. MBAs are going to have to come to terms with this. How are we actually going to provide the high quality healthcare we want our citizens to have, and also pay for it through our taxes or through private payments, and how do we make all that work? The best preparation for these challenges is to really get a sense of how these different fields work, whether it's the finance side or the healthcare side. I think the more you know about the sector and the more you know about how the sectors interact with each other, the better prepared you'll be to help find solutions to really difficult problems. I think MBAs are well positioned to interview for a wide variety of jobs in healthcare. Certainly jobs in government that relate to finance or in the health ministries, jobs in hospitals on the administrative side and the policy side, jobs in pharmaceutical companies or related research and development companies, and frankly, jobs in larger firms that have a lot of health benefits for their workers. Our MBAs will be well positioned for all of those. Rotman has lots of assets. It's in a great city within a great university. I think it's clearly the top business school in the country by a long shot. I think that students here have access to the business community in Toronto and across the country and really benefit from an international faculty and international student body. The challenges in healthcare span business and government. They have qualitative aspects and quantitative aspects, and Rotman MBAs are well trained to deal with these problems comprehensively instead of one by one. In addition, Rotman sits right across the street from the provincial government, right down the road from a major hospital complex, and provides students with access to all kinds of policymakers, researchers, and faculty that really can make a difference.